I'm Paula Nutting, your musculoskeletal specialist. Today we're looking at all things jaw. Now, jaws have huge impacts on the entire body. We see people that have clenched, locked, night grinding, teeth cracking experiences. It's amazing how much impact a tight, locked jaw will have on the entire body, specifically our posterior line, specifically our gluteus maximus. Now, it's a really easy test to do. What I'm going to do is test, strength-wise, how good Kevin is to hold his glutes so that he keeps his foot down on the table. So can you keep that foot down for me? All right. So I'm trying to lift, and there's no way in the world that that leg is coming off the table. He's activating his gluteus maximus on this side to keep the foot down. Can you please tighten your jaw up for me as tight as you can? So he's now locking that jaw. Keep that foot down for me, okay? Keep it down, keep it down, keep it down. Okay, keep it down, keep it down, keep it down, 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 down. Yeah, so he's not doing it. That jaw has turned off at C2 level. Open your mouth for me, give it a bit of a wobble. Let's open up and clear that, hold that foot down for me again. And that strength has returned. I need my foot, your foot, my hand. So be mindful, bad jaws reproduce right down to the lower body. Let's have a look at a really good way to loosen off that jaw. Okay, so looking at our jaw, specifically our mandible, we're going through the angle of the jaw, and that back angle of the mandible will come up and meter in just near the auditory meatus, so near the ear. So we're going to come along with our fingers, and we're going to ask our client to push their lower jaw up towards the ceiling. So up it goes for me, and I'm going to pop my fingers underneath that, just in front of the lateral angle, and hold my fingers up there, and he's going to rest his jaw so it just butts down onto my fingers. It's quite painful, yeah, yeah. So you can hold that position there for up to 15 to 20 seconds, 30 seconds, just to have a bit of a positional release technique. But we can also add a little bit more bang to our bucks by putting a muscle energy technique, and he's going to try to pull his jaw back towards his neck, so it's pulling back or retracting. Clients don't know when you're asking them to retract, so just ask them to pull their jaw back in, and we're holding it for 10 seconds and then relaxing. See, his head's a little bit of a tilt, so I'm going to make sure that he's back into a more neutral. We're going to rest it, and then he's going to take that jaw forward again up to the ceiling, and we're going to find that new position and push up gently. Release the jaw for us. Is that feeling a little bit easier? You might do this between 3 and 6 times. It can be quite painful. Okay, retract the jaw down. That's excellent. Make sure that they're breathing. Make sure that their glutes are nice and loose. And relax the jaw. Now, I don't ask them to do big breaths in and out, but I do watch when they're doing their out breath, and that's when I relax it off. We're going to give that neck a little bit more of a stretch. All right, jaw up to the ceiling. 3rd time, and you can see he's getting a little bit more range, and I'm going to come up under here again, and then let your jaw relax. This can be included in releasing the pterygoids, especially the medial pterygoid. They can do some lateral joint movement for the jaw, and that will help as well. And pulling that down. Excellent for clicking, for locking, temporomandibular issues. Watching for that breath, and as he breathes out, I relax. Good work. Any work on the jaw is always going to be a little bit uncomfortable, but over time it will help a cranky upper neck as well. I'm Paula Nutting, your musculoskeletal specialist.